Hi, this is Steve Adubato. We're at Morven Museum and Gardens for a conference, an important meeting on the subject of overcoming childhood adversity and trauma. A whole range of people from across the state, from across the nation, coming to talk about children who are affected by toxic stress, if you will. And two of the experts that are joining us here tonight are two longtime friends who have been with us before. Mary Ann Christopher, Vice President of Community Health at Horizon Blue Cross and Blue Shield in New Jersey, and Dave Huber, CFO at Horizon. Good to see both of you.
Good to see you as well.
We were talking right before we got on the air. The issues we're talking about, adverse childhood impact of these events, these horrific events, if you will, otherwise known as ACEs, if you will, right?
That's right.
Why are they a community health issue?
Well, they're a community health issue because many of the issues derive from the community and the neighborhood and the blocks in which children live. It's their home that's an impact, their neighborhoods, their schools. So that's why the solution has to be grassroots and community-based.
And what's interesting about this is that because there's some corporations, foundations that are here, and by the way, there's $2 million being put up of seed money from the Nicholson Foundation, from the Burke Foundation to deal with this issue. But Horizon has been very much involved in a whole range of public-spirited efforts, including supporting those of us in public broadcasting. But why is this an issue, these issues around adverse childhood effects, right? These experiences, if you will. Why is it a Horizon issue?
I wouldn't say it's a Horizon issue.
Why is it an
it's
issue
a society issue? Why do we care about this?
Yeah.
We're in the middle of everything, right? We work with the hospitals, the doctors, the members, the community health workers. We got 50% market share. We can make a difference. And we're doing a lot of great things already. Mary Ann can tell you about that. We think we can take ACEs, integrate it into what we're already doing, and make a big difference for a ton of people. And we're happy to do it. We think it's our responsibility, not alone, but together. We got to collaborate. It's the only way.
Talk about this, the ACEs, as Dave talked about, adverse childhood experiences. Again, let's try to be a little more specific. There are 10 of them that I've read about. Are we talking about if a child has a parent with a substance abuse problem, if a child has a parent or parents who are, there's a lot of domestic strife, or there's divorce or separation, or what other kinds of things are we talking about?
It could be the loss of a parent, loss of a sibling, grandparent, violence in neighborhoods, poverty. All of those come together to really create the constellation of factors that put children's health at risk in the moment. But I think to your earlier question, why is it important? Because we know that ACEs unaddressed have lifelong impacts on people's physical and mental health status.
Break it down a little bit. We're talking about heart. The issue of heart disease keeps coming up, as well as cancer, correct?
Yes, heart disease, cancer.
That.
Because any of these stressors, these toxic stressors, impact negatively the body because it kind of drops your immune system, right? Because the immune system is directed toward the stress, and it also stimulates your central nervous system in ways that cause stress on the heart, on your immune system, frankly, on every aspect of your body, because when that stress happens, it triggers the sympathetic nervous system that then impacts every part of the body. So imagine children not knowing what to do, not knowing how to frame those issues. And so they just begin to integrate that stress without the tools to know how to cope with it. And that's what we really aim to address.
Dave, let's follow up on this. There are economic considerations here as well. Talk about them a little bit.
Without a doubt. We're on the movement toward value-based care. Right, the old model was people get sick and then we pay claims.
Fee for service.
Fee for service.
Moving away.
Moving away. Value-based care. Get a flu shot, don't get the flu. This is the same thing. And traditionally, health insurers haven't really been involved in social determinants. What Mary Ann's talking about, it's groundbreaking.
Social determinants of health.
Social determinants of health. It's groundbreaking. But we're talking about working with community health workers. We're talking about navigating the system. You get sick, you're not used to navigating the system. How do I find a good doctor? How do I get an appointment? How do we get there? We drive people to appointments. All of that. There's a lot of things that cause issues, and there's a lot of people out there aren't getting the care that they need, and they don't know where to start, so we think we could help.
It's interesting that Horizon's also partnering with one of the other entities we know well, RWJ Barnabas Health, on these social determinants of health. Is that a model that's happening more and more, that organizations like yours, health insurance providers, and and healthcare providers, hospital systems, are collaborating on these issues?
Yes, we had really an amazing collaboration in the city of Newark in 4 zip codes with Robert Wood Johnson Barnabas, where we co-funded community health workers to address social determinants, the burden of where people live having such an impact on overall health.
And social determinants, Dave talked about it and I've talked about it, but I don't want to assume people know what we're talking about.
So social determinants it's based on the theory that where I live has more to do with my overall health than anything else.
My zip code.
My zip code, my block, my neighborhood. And so it's transportation, food insecurity, violence, even ability to have housing. How does housing impact what I do with my income? How do I distribute that? And so we have come together in an amazing program where we actually have an integrated team, both from Horizon and Robert Wood Johnson Barnabas, engaging the community, funding community health workers who are trusted and relevant to our members who are disproportionately impacted by social determinants. And over the next 3 years, we will be rolling that program now in 4 zip codes out to about 75 zip codes.
It is powerful, and I'm curious about this. I mentioned the economic part. Other than making a difference in people's lives, does this have the potential, Dave, to actually lower overall healthcare costs?
Without a doubt. Value-based care. Think about getting a flu shot versus waiting until you get the flu and getting admitted to the hospital. This is the same thing. We think if we can help people early on, help people stay healthy, they're going to be out of the hospital, they're going to go see their doctor when they ought to see their doctor. Preventive care pays off big time at the end of the day. We believe that there's a real ROI in this for us. We are doing it because it's the right thing to do, but we do think there's an ROI in it for us too.
And finally, as it relates to ACEs, the whole question of early intervention is also part of what Dave's talking about as well.
Absolutely.
Is adverse childhood experiences, stepping in earlier as opposed to saying, well, you'll get through it, or just ignoring it as a society is incredibly irresponsible, not to mention incredibly expensive.
Absolutely, and that's why as we roll out our value-based strategy and our social determinant strategy, we will integrate the training to identify ACEs into every person that touches that child. So the identification is immediate, and the intervention is immediate as well.
I want to thank you both for joining us. We appreciate it.
Thank you, Steve.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of State of Affairs with Steve Adubato has been provided by the Turrell Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, the PNC Foundation, St. Joseph's Health, Rowan University, NJM Insurance Group, and by MD Advantage Insurance Company of New Jersey. Promotional support provided by the New Jersey Business and Industry Association and by Jaffe Communications, where business, media, and government converge in New Jersey.